if you could sign in the back corner, we'd appreciate everyone signing in so we can track attendance. And also in the back, you'll see that they brought some information on WIC and also their business cards, so feel free to pick that up this morning. Today we have two ladies from WIC here to talk to us. We have Mary Willett and Jennifer Gall. They're going to introduce themselves a little more and tell us about the WIC program that we have access to.
Well, good morning. And my name is Mary Willett. I'm a registered dietitian and I'm the Jefferson County WIC director.
And I'm Jennifer Gall, and I'm a registered dietitian also with the WIC clinic, and I'm also the breastfeeding coordinator.
So today we're going to give you an introduction to our program. Our main office is in Jefferson, and we also have a satellite clinic here in Watertown. So we all know what WIC stands for. It has a more formal name, the Special Supplemental Nutrition Program for Women, Infants, and Children. The special part refers to that this program is only for certain categories. Not everybody who is eligible or income eligible can be on WIC. It's for low-income pregnant, breastfeeding, non-breastfeeding postpartum women, infants up to 12 months, and children up to the age of 5. WIC families must meet certain requirements. They have to reside in Wisconsin, but they don't have to participate in the county where they live. For instance, as we all know, Watertown has 2 zip codes. The people on the Dodge County side are actually counted in our WIC program. And people who live out in the country north of town, it may be easier for them to come here to our WIC clinic than to drive to Juneau. We also have families that come to us from Walworth County, Waukesha County, Dane County. Sometimes it's just easier, or the WIC clinic is closer to their homes. WIC participants have to have an income of 185% of poverty level or less, or they can be enrolled in foster care, kinship care, or food care. Many families that are enrolled in Badger Care are also eligible for WIC. And then the final requirement is they have to have a nutrition risk. So, of course, we all think of, being underweight, having a low iron level, not having an adequate diet. Those things are nutrition risks. But we also consider many other things. For instance, if a young lady is age 17 or less when she becomes pregnant, that's a risk. Cigarette smoking, drug use, alcohol use all put a pregnant woman or a mother at nutrition risk. Inappropriate bottle use, being on a bottle after a year, or taking that bottle in bed to fall asleep, that's a risk.
Okay, so WIC provides many benefits to our participants, not just food. And one of those benefits is nutrition education. So on our WIC staff, we have 2 registered dietitians, Mary and myself, and a dietetic technician, Vicki, who's awesome. And we assess every participant that comes in for their nutritional status, their eating habits, nutrient needs, and any feeding concerns. We use the motivational interviewing so that we can set goals with the families that are achievable, so they set them themselves so they're more apt to follow through with things. And we also stay current on nutrition information so that we can provide the most up-to-date guidance for our participants. So nutrition education is a big part of our program.
Another big part of our program are the foods that we provide. They are healthy, wholesome foods. In the 40-plus years that WIC has been in existence, the food package has changed quite a bit. So at the current time, we offer fruits and vegetables at the grocery store and through our farmers market program in the summer. We offer whole grains, and that's not just cereal, but they have options of whole wheat bread, brown rice, tortillas, and whole wheat pasta. We also offer low-fat dairy, and for people who can't tolerate lactose, we have lactose-free milk or soy milk. We offer infant foods, which includes now baby fruits and vegetables in containers. We offer iron-fortified formula for those infants that are not breastfed. And then for children and infants with special healthcare needs, we also can provide special formulas.
So breastfeeding is a big part of WIC also. Even though we do provide formula, breastfeeding is our number one go-to for promoting for healthy infant outcomes. So we provide education during pregnancy on breastfeeding. We have the one-to-one support from our staff, and we all have advanced training and certification in lactation. We also have a mom-to-mom support program, which are WIC peer counselors. We have 2 WIC breastfeeding peer counselors. They have been on WIC themselves, have successfully breastfed, but had their issues too. And they contact all moms in their pregnancy and then after they have the baby to provide that support within their scope of practice. And then we also support the moms after delivery if they have any questions, concerns, or problems. We're always willing to do home visit if they need that, if they can't make it to the clinic for follow-up. So one other program that's more recent is called the COFECTIVE Initiative. It's a collaboration between our state WIC department and the Chronic Disease Prevention Program. And it's between the WIC clinic and the hospital, so we can provide a coordinated, consistent message prenatally for our moms. And they receive evidence-based care in the hospital. So our WIC moms are preparing beforehand so that when they get to the hospital, they know what to expect. And all the information is aligned with the baby-friendly hospital initiative and improves breastfeeding outcomes. So every hospital has been given the opportunity to work with the COFECTIVE program, and I'm happy to say Watertown is one of those. So we're going to work together to prepare our moms better for delivery. These are some of the tools that COFECTIVE has available for our participants. We have the We're Prepared checklist, and it outlines 15 evidence-based practices that prepare mom for their hospital stay. We have the motivational document, which helps families prepare for the birth of their baby by outlining key ways to get a good start. And some of those areas that they really promote are your skin-to-skin contact, right after birth, rooming in, that magical first hour with your baby. And then there's also a free mobile app that our participants can download, and they have videos and captivating photos and from the mom's perspective, so it's been well received.
Another part of WIC is a caring support community. One of our part of our mission is referrals to other healthcare providers and community services. So we provide referrals back to you, for instance, for low hemoglobin, high lead, growth and feeding concerns. Both the Watertown Health Department and the Jefferson County Health Department have the prenatal health care program for Medicaid participants called PNCC. We do referrals to birth to 3 many times for speech concerns. Head Start is another big partner of ours because we both serve the same population, the under 5 preschoolers. We have smoking cessation with the First Breath program. Jefferson County offers water testing for those who live out in the country and get their water from a well. Both health departments have a car seat program. In Jefferson, we have a dental varnish program for children under the age of 12. And we are very lucky in our county to have access to the community dental clinic in Fort Atkinson, which is for people who have no dental insurance or Badger Care. So to just demonstrate our support community, let me tell you about a little girl that I once knew. Okay, a while ago, probably 7 or 8 years ago, the Jefferson County Public Health nurses had well child clinics out in several cities in our county. So this was at one of those well child clinics, and WIC went along with the public health nurses so that people could get all their services at their home location in one day. Josie was born prematurely, but she didn't have any health problems. When we had her 1-year WIC appointment, when we do the lead and hemoglobin, her hemoglobin was slightly low. And this low hemoglobin continued throughout her WIC participation. So at one point I asked her mom, well, why do you think her hemoglobin is low? And she said that the child had fallen and cut her forehead, which bled profusely. And so at the time, I didn't quite know what to think. Her parents were receptive to counseling on the iron-rich foods and weaning from the bottle, but they kind of had a hard time following through. And I just want to mention, there was a language barrier, and we do have an interpreter, but it did not come to our attention. Every time we would ask the mom, hey, do you have a doctor? Yes, I have a doctor in Madison. But they never went to see the doctor. They always went to the well child checkups. So when Josie was 4 years old and she had a WIC appointment, her mom reported that when they go outside and play, she'd really have to watch her because she wanted to eat dirt. And when they were in the house, and if they were coloring or reading, she wanted to eat paper. She had a poor appetite and she was really tired. So then when we did her hemoglobin, it was 6.5 on that day. So we immediately called the public health nurses over. They contacted the child's doctor, who didn't know anything about her, but they got her admitted to the hospital that day. She stayed overnight, and she was discharged with an iron supplement. So then we saw Josie when she was 4.5, and her mom reported that her hemoglobin was now checked monthly by her doctor. She also saw a specialist at American Family Children's Hospital, and she was diagnosed with a blood clotting disorder, so that could explain that profuse bleeding from that cut. Her appetite improved, and at that time she continued with a daily supplement of iron and then 2 servings of iron-rich food daily.
So other programs that we provide within the WIC program include our Breastfeeding Peer Counselor program, which I had mentioned earlier. And we do have two breastfeeding peer counselors. One is Hispanic, so she meets the needs of our Hispanic and Spanish-speaking population. And she does a great job with them. And we also have the breast pump rental. We have about 10 hospital-grade breast pumps that we can loan out to our participants. We only ask for a $20 deposit, but if they can't do that, we just loan them out for free. So most insurance companies now provide a breast pump, a double electric breast pump, but we do have those available if needed. We have the Farmers Market Nutrition Program. Most all of our families qualify for this to receive $20 in vouchers to use at area farmers market for locally grown fresh fruits and vegetables. That runs from about June to October. And we have our Fit Families program, which is funded through the SNAP education program. And that's for our children that are ages 2 to 4. It's an optional program. They can sign up. It's year-long. It encourages our families to eat more fruits and vegetables, drink healthier beverages, and move more and watch less. So we set an individual goal with that child, and that family can model that goal also. We are the health coaches, and we provide information and monthly contacts for our participants. And then the children receive reinforcement items when they come into the WIC clinic, which are prizes.
Okay, so like I mentioned before, the WIC program has been around for over 40 years, and we are constantly improving and making things easier for our participants. So we used to use WIC checks, and these were very easy to lose, and they were kind of hard to use because you can see on this one, there's a whole list of items. But what if you just really needed a gallon of milk? You would have to buy everything on here or lose it. It's just a one-time deal. The other thing about the WIC checks, if somebody lost their checks, we would have to make them wait for 2 weeks before we could replace them, because we had to make sure that somebody else didn't use them in the meantime. And then when we finally were able to replace them, we could only replace half a package. The other thing about the checks was they needed special paper, special check paper. We needed a special printer, a Nicker printer like they have in banks to print this out, and that was all pretty costly. As Jennifer mentioned, now we use motivational interviewing, which is much more friendly, more considerate, and more helpful to clients. But we used to have classes, and you can see that lady has red hair and glasses too. And they used to talk at people, like Charlie Brown's mom.
So some really great things that have come within the last few years with WIC. On the right is the EBT card, which has replaced those checks. So our participants just love the card. They don't have to buy everything at one time. They can just buy what they need. Their balance stays on their card until the end of their month. And then we can reload their card from a remote location if needed. So, and the cashiers at the grocery store really enjoy this card too. It's much easier to use. On the left, we have the Wisconsin MyWIC app that we encourage all our participants to download. It will show them what their balance is, what they have left on their card, and it also has an option where you can scan the UPS or barcode of a food and see if it's a WIC approved item, so they no longer have to get up to the checkout line and then find out that their WIC food isn't approved. So they can just scan it right while they're shopping to see if that's an approved food or not. It also will show or tell them when they have appointments coming up, and they can also search to see where their nearest WIC approved grocery store is. So participants love the new app. It's really easy to use for them too. We also have online nutrition education modules that our participants can go to when they're not in the clinic, and it provides another source of nutrition education for them. And we also have our Facebook page, which our coworker Vicki updates very regularly, and we have a lot of our participants on there, and they get up-to-date nutrition information on our Facebook page. And WIC works. The research shows that WIC moms and children use the preventative care at a greater rate. We're following them closely. Children have improved cognitive and academic abilities. The WIC participants increases key nutrients in the diet. All our foods are there for specific nutrients. Women enrolled prenatally have better birth outcomes and fewer preterm and low or very low birth weight babies. 84% of our moms at least start or try to breastfeed, and that could have the reason that number is good. And then every $1 spent on WIC during pregnancy saves up to $4.21 in medical costs.
So So now we have a favor to ask of you. Later this spring and during the summer, we will drop off our WIC brochures and posters, which are small, to your offices, and we would like you to display them. Now, we know that when you have appointments with your clients, you have a lot to talk about. But if you see somebody that you think is struggling with food security or maybe some basic parenting or feeding skills, please let them know about WIC. Call us with any questions that you might have. And we want to thank you for everything that you do. And then we have just from a WIC participant, her story.
My husband's name is Matthew. We have our kids together. I was a freshman in high school, and it was really scary because I did not think that I was going to be a teen mom, and that's exactly what I was. When Rick introduced me to all the programs that they offered, it really took that fear away and gave me a confidence, like I could do this. I would have never known what healthy was if I would have never talked to Rick. You know, I'm not buying soda, I'm not buying candy, I'm not buying chips, I'm not buying junk food. I'm buying healthy stuff. So I'm actually leading a healthy life for my kids and for myself. I mean, my daughter, she loves fruit, okay? And so I would push her in the basket and she would tell me, Mommy, I want this, I want that. I was able to get it because of Rick. You know, like, it was really awesome. I would love it. I really did. If it wasn't for that support, knowing that I was grandmother, that I could do it, I really honestly don't think that I would have had that motivation to want to do better. It completely changed my outlook on my life. I'm happy in my life, and I would never take anything back. I would never do it any other way.
Any questions? Yes.
So I missed the initial part of the presentation. What are your biggest barriers for people to use WIC? And now we presented what WIC is. Now there's a very target audience sitting there. We need to see what are your challenges. How can we increase the usage of WIC in our community? And how can we follow it up with what needs to be done?
Well, I think one of the biggest barriers for WIC, and I'm kind of surprised myself because I've been working for WIC for 13 years. It seems like one of the biggest issues is transportation. And it seems to be getting worse. You know, instead of people, it's hard for people to come to WIC. So that's one of the reasons that we have the online and we do telephone nutrition education. People have to have 2 appointments every year. And then they would come in between the appointments to get their card reloaded and have their nutrition ed. So that's one thing that I think is really helping. We can now just call them on the phone. You know, and especially this last winter, a lot of people were very thankful because they would have, you know, a mom, a baby, and 1 or 2 other kids, and it's snowing, and you don't have a car. How am I going to get to WIC? That's okay. We can call you. If you just take a few minutes to speak with us, we'll issue your benefits over the phone. So I think that is better. Now, I am not sure why WIC participation is decreasing. It's not just in our county, it's not just in our state, it's within the whole United States. And nobody is quite sure why.
Is it a state-run program?
Actually, I did kind of, because I was
So I
nervous.
missed the initial.
Yeah,
so-
I glossed over that. It is administered by the United States Department of Agriculture. And if you've ever heard, you know, they'll say on the news, oh, they're talking about the Farm Bill, pay attention because the WIC is in the Farm Bill. Okay, so USDA gives each state a certain amount of money for WIC. And then the state WIC office distributes the funds to the different projects. So in our state, projects are run in counties. Except for like the city of Milwaukee, they have several WIC projects.
So are we utilizing the services that we are budgeted for?
Pardon?
Are we utilizing the services for the budget that you have received? You do receive?
Yes, we do, because
Because there are two things, there are three things that can happen. One thing is, Doc, I don't have money. You're sending these patients, we don't have money. Second, we do have money, but we're underutilized. And we can take more patients and referrals. The third component would be that, look, we are okay right now, we don't want to expand. And we don't know what the future is. So what we need to, this is what is important for us to know. What services is very important, but where are we leading to and what do we want to do with this program? So it may be something that we need to think.
yes. Well, first of all, even though, see, we get money based on our caseload. Our caseload has gone down. They took some money away from us. However, we are able to make it on the money that we have. We are. If we get more clients, we get more money. That's another reason why we're doing the Fit Families program, because they give us money for the Fit Families program. That's coming from another separate set of money. So that way we can, again, serve our clients better. That's why we're doing breastfeeding peer counseling. That's another grant that we get. But in a couple of years, instead of just saying, hey, we're doing breastfeeding peer counseling, give us money, they're going to make us apply and prove that we have a good peer counseling program. But we're ready for that.
Can I answer some of that question? So, for those of you who don't know me, I'm Carol Quest with the Watertown Health Department. So this is part of a community health improvement plan initiative regarding nutrition. And we know that there are many families in this community that could benefit from WIC, are eligible for WIC, but are not taking advantage of the program. We are getting the referrals postpartum, and we visit those families, and they could have been on WIC the entire pregnancy or with a previous child, and they weren't. So that is why they are here today to talk to you, to just give you some high-level information about the program, and hopefully start to have you talk to your clients or give them the information in your office that this program is out there. Maybe you've heard that it takes a lot of time, but things have changed with WIC. It isn't as burdensome as it used to be. It's very convenient. And we know from what we're seeing in Watertown with our public health department, as well as the 2 county health departments, that there are many families that could benefit from this. They are not taking advantage of it for a variety of different reasons, but if you can have that conversation with your patients early in their pregnancy, everybody will benefit from it. So, thank you.
Thanks, Carol.
I can't help myself.
And the eligibility for, to be part of the WIC participant, I'm sure that you must have covered.
Yeah.
I missed the initial part. So you need to be eligible to be a certain poverty line, or is that?
Yes, 185%.
But you don't have to know that.
What is that number in real dollars?
Yeah.
40
For a family of 4.
4.
Yeah.
Yeah, it changes.
40,000.
For a
For a family of 4. But that changes every
Yeah.
year. It changes in June of every year.
And
But
you
it's
don't
higher than what you would expect,
Yeah.
I think.
You don't have to try to remember that. If you just say, you know what, I think you should just give the WIC office a call, and they'll help you to determine whether this is a program you can take advantage of. they'll work with the family, they'll evaluate their income, so it's not something you have to try to remember.
As a peds nurse, one of the biggest challenges I had was the moms running out of formula, because as far as I understood, WIC was supplemental and didn't give them the full amount to cover a month. So they would contact us to see if we had samples we could give, what direction. Can you tell us really how much they do get a month, how much you would expect they are short?
Well, we offer different levels of formula based on the baby's age. And you're right, it is supplemental. We can't provide all of the foods that people need. So from 0 to 3 months, they get 9 cans of formula. From age 4 to 5 months, they get 10 cans of formula. And then at 6 months, we have an appointment. And then at that time, the amount of formula goes down to 7 cans a month. And then they get baby cereal and baby foods also.
So for some babies, it's adequate, and others, if they have to buy.
Where we really saw the challenges were things like Nutrimagen, where it's just so crazy expensive, and they could not afford it.
And if
It's
they
like
can't,
$100 a
yeah.
week.
And that's where we try to refer to children with special health care needs, and because they can help figure out medical costs and how to pay for some of those things if they can't afford it.
Okay, yeah, we didn't know the clinic guys, that we didn't know that, for them.
So what's that program you mentioned? Is that part of the WIC program as well?
No,
Supplemental
it's a
needs?
separate program, Children with Special Health Care Needs. It's a network. And there's different regions, and we're part of the southeastern region, Jefferson.
Federal program, state program?
Both, it's a Medicare, or excuse me, Medicaid program. And you can refer to either Children's Hospital, Children with Special Health Care Needs, or the Wiseman Center. That's a Children with Special Health Care Needs program, and they can assist families in getting additional funding. Katie Beckett, for those of you who've been around for a while, that program is run through Children with Special Health Care Needs as well. But it's a larger program, but it really does focus on children with health needs.
So I have a question off of that. Are there any programs in the state of Wisconsin for people that do not meet the income requirements for Medicaid or any of these, but have complex medical issues that need the elemental formulas that are $40 a can, but they're not at any kind of poverty level, but who can afford $40 a can?
Yeah, and I'm not sure how that would get covered, but I would refer them out to that program. That's
So logistically, if I want to think and devise a plan, how to actually present it in my group of people, I want to have a list of all Medicaid patients, all Medicaid, because by definition they have to go and have certain poverty level to get Medicaid state. And if I want to implement it, it's a simple way that we can educate these group of people how to utilize your services and how to utilize the WIC services on a regular basis. So if I want to push a program within our department, there's a simple way of doing it. When we say that the moms who delivered here are not utilizing, that means that we are not doing a good job in presenting what are the resources for these guys. The simple solution to this would be, how can we do this?
And we really work together. They're a public health program, and that's why they're here, to just start this conversation, to raise awareness that this is an important service, and just to help you think about it. We know that your office time is very limited. We know that, but that is the point. How do we better serve the population and make them aware of these programs?
And at the state level, when you're talking about the transportation, that was the #1 barrier. And I was just there 3 weeks ago and discussing how can we remove and introduce the concept of breastfeeding through e-visits, through video visits. It has been implemented, and we proposed a project is that how can we do breastfeeding and counseling through remotely, and that's where we remove the barrier. as well. So
They
I
go to the
absolutely-
home too.
What's that?
They,
And the concept of improving home visits as well.
So I have two comments. I totally agree with one. So we need to do a better job educating patients, but we've had patients before where they're like, yeah, I know about WIC. But they're not empowering themselves to make the phone call. I literally had to pick up the phone, dial it for the mom, say who I was, say what she needed, and hand her the phone. And even then she was like, I don't really want to talk to her. I'm like, you're getting food for your baby and 4 kids. Like, this is important. You need to do this. And I don't know how to change that mindset of spoon feeding patients and not having them take ownership of this. That's my first comment. My second comment is, have you guys reached out to the school district and the school nurse to help identify families? Because I know by the time they get 5, those kids might not qualify, but they have younger siblings. Douglas, for example, is the poorest elementary school in our district, and I don't know if anybody realizes how not well off some of those kids are. So I don't know, reaching out to the school district and talking to the teachers and the school nurse and really like letting them know what services are available to help these families.
I think that's a great
Yeah,
idea.
it's a great idea.
We work a lot, very closely with the Head Start program to make sure those children and families know about the WIC program. But
Yeah, I think that's a, sorry.
Good idea.
I was just gonna make a comment, when I do get, a lot of times, I'm a family physician, the first experience I have with newborns is when they're coming in for their, 2-day check or 2-week check. It's almost always, so I wanted to say, I think there's a lot of this is working very well from a communication standpoint, because almost always are already involved with WIC and they're already aware of it. It's, if they're Medicaid or they're low income, they've already had that arranged. So, kudos to the OB department and Megan. That word's getting out, at least from my end. So that doesn't ever seem to be an issue, because they're always telling me, well, I get this from WIC and whatnot, and so I think that the word is getting out. I think probably, to piggyback on your comment, I think the transportation issue probably is the greatest barrier. I think they know about it, so, at least in my experience.
And I think the comment from Addie is very important, is that how can we empower women to make and empowerment actually not only comes from the education and constant support, but also making the process easier for the moms to do it, and following up and reminding the importance of doing this. So it's a process where we need to look into identifying those moms or families where we find that there are barriers for them to accept WIC, but it's great to know that people are utilizing. So we need, again, numbers talk. So we, as a department, have always said that, look, we need to have what our current usage is, what should be our goal, how can we target these people, and how can we make a program much more easier for them to address this. So from the process perspective, I think we need to have these numbers and goals for us as a department to run and move from that point onwards.
And to that point, so between the 2 counties, we are looking at numbers, participation and the population numbers of individuals that we know in the 2 counties that would be eligible, and then the numbers that are participating. So we're really trying to move that forward, and so all of these discussions are really important in that, and we have to do it together. We're all really important in this work, and the message that providers give to their patients is so important. They listen to you, they really do, and the more times they hear the message about a program like this, they're more inclined to go, well, maybe I do need to follow through. So, and the work is happening, but if we could just think about it a little bit more and how we can move forward together.
could it be something in the EMR that, with our pediatric, the forms, in Meditech at least, we've got like 500,000 questions, many of which are not very useful, but I think it might be useful to have one that says, had she applied for WIC for kids that are under 5, and that would give us a little, reminder that would be something to talk about.
I think it's a great thought, absolutely.
They're on the new, I've seen them on the Nurse Navigator, the new OB.
Okay.
There's WIC questionnaires on the new OB ones, but they're not on our Real Child templates. So I think that's great to add that to the Real Child. So.
Who's in charge of that for the clinic side?
Dr. Liberal.
So what practically happens in your office when somebody is too high income and they go through your screening process and they're 200% of poverty level? What actually happens to them in your office?
Well, because we're highly regulated, we have to explain to them why they're over income. We have to give them a letter that says you're over income and you do have the right to contest this, but nobody really does. And then we always say, if anything changes in your situation, please give us a call. Because a lot of times somebody could lose a job, one parent could lose a job, they could all of a sudden become pregnant, which would increase the number of people in the family. So, that's what we do.
And for the food aspect, we give them information on the different food programs, different, hot meals where they can find hot meals.
Food pantries.
We can give them that information.
So to answer the question, what happens to these guys, what are the different resources? From the employer and employee benefits section of people, we don't think about it, but there is a huge benefit of your FSA and HSA accounts. And people have to think in terms of the HSA accounts as well. So I think that's where people have to rethink, because state is not giving us solutions. We need to find at our level to find and fund these things locally.
There's private grants too that I.
And they're private grants as well, absolutely. Well, thank you so much.
Well, thank you guys. Thank you very much.